We conduct our own self-sponsored research each year just to extend our knowledge, and this year we're focusing on the consumerization of healthcare and how it's affecting several related industries. And we're happy to present this to you and glad you joined. I'll talk about 30 minutes, try to keep it short, and as Brad mentioned, we'll have time for Q&A at the end. And of course, please reach out by email or phone with any questions or comments. Also, I'll have my contact information at the end. Just to jump into it, first, what do we mean by the consumerization of healthcare? As you likely know from being in the industry and from all of us being consumers, there are greater costs shifting to consumers, especially with high deductible health plans. Simultaneously, there's also more competition with signs that consumers are expecting more convenience and fewer barriers in their healthcare. And likewise, there's consumer-oriented companies that are looking to influence healthcare delivery, and they're often in the news. Some headlines, just to highlight some of that we tend to be seeing, is Apple introducing their health record. FitBit often in the news, trying to change healthcare. 2017 was really the year that consumer DNA testing took off with 23andMe and Ancestry.com. Many of you probably heard about Amazon leading the way with Berkshire Hathaway and JP Morgan, trying to set up a new kind of healthcare delivery for their own employees to begin with, and questions about whether or not that will change healthcare in great ways. We also often hear about Uber and Lyft trying to bring ride sharing into medical care and what changes that may bring. Often, too, many stories about how millennial doctors and millennial patients may change the healthcare world. And then just last week, Apple was again in the news with their new Apple Watch, which has a new ECG monitor in it, as well as fall detection. And there's lots of discussion about whether or not that'll be a net benefit, or if there'll be some potential healthcare headaches coming from consumer devices like that. So with all these changes occurring, we wanted to explore in this research the emerging state of healthcare consumerization. And what that meant is we wanted to take a broad view in a number of areas. We wanted to look at consumer and physician readiness in a number of areas. One is around readiness for consumer health technologies. And in this study, we looked at readiness for wearables like Fitbit and Apple Watch, as well as for health apps, consumer DNA tests, ride sharing like Uber and Lyft, remote monitoring, telemedicine, and we also asked about Alexa and other voice-activated devices. We also wanted to better understand readiness for consumer-centric convenience initiatives, and by that we meant patient portals, things like self-scheduling apps, new sites of care like urgent care, and an emphasis on price transparency. We wanted to try to also understand how demographic differences may influence healthcare consumerism, including looking at generational differences and whether urban and rural differences play out in this area. And we wanted to get a better grip on the unmet needs that consumers and physicians have with these consumer technologies and convenience initiatives. And lastly, who they see as thought leaders on both the consumer technologies and convenience initiatives. For this presentation, just in the interest of time, we're not going to be addressing a couple of areas, but we do have the full deck, and we're happy to send that out and or set up one-on-one meetings. So we won't be addressing in this discussion ride sharing, new sites of care, or price transparency, but we will tackle all of the other areas. So to give you a sense of what we did, we're actually planning a two-phase study. This webinar is about the phase 1 qualitative, and then in the next month or two, we'll be doing the phase 2 quant, and we'll have results from that by the end of December. As with all qualitative, we believe these findings are telling, but they are based on a small qualitative sample, and we'll be testing these findings in the phase 2 quantitative. The physician arm of the qualitative involved 10 30-minute phone IDIs with primary care physicians. And it's important to point out this study is just about primary care physicians, so the research is limited there. Results among specialists might differ. And you can see the mix of primary care physicians that we included in this research, differing in terms of internal medicine, pediatrics, GPFP, or OBGYN, differences in terms of health system or independent affiliation, generational differences, and so on. The consumer arm of this study was, again, 10 30-minute phone IDIs with consumers. They also differed in the metrics you can see on the right by insurance type, generation, geography, and so on. It just turned out that all of our consumers in this small qual all have primary care physicians, and about half of them report having a chronic or severe condition. So to jump into the findings, the key findings that we identified from the primary care physician interviews, there are five that I want to call out. Um, First is that most physicians really are open to talking with their patients about wearables and health apps. But for those who really champion them, those who are really advocates, it's really because of the patient engagement that they see. So objective data and efficient sharing, those are also valuable benefits from wearables and health apps. But it's really patients being accountable, engaging with their own healthcare. That's what's really exciting physicians who become champions for health apps and wearables. And we'll dive into this in a little bit more in the detailed findings. A second observation we had from the PCP research is that readiness for patient data sharing outside of the office visit, that is really a divisive issue among physicians. So again, just to make the point, it's about data sharing outside of the office visit. For some physicians, typically older or independent from a health system, the first thing that comes to mind for them about data sharing is to first think about liability and workflow concerns. In contrast, other physicians, typically younger, affiliated with the health system, they actually want their patients to send them data prior to the office visit. So we found that really interesting, and we'll have some more information about that. Third finding was around consumer DNA testing in physicians. Most PCPs, including millennials, are not ready to help their patients with consumer DNA tests. They were very clear about this, that genetic counseling is outside their expertise, referrals are hard to find, and they're getting little guidance from professional associations or even from their health system. Fourth, when we talk with PCPs about telemedicine, most are really excited about telemedicine for specialist care, but they're really less engaged about it for primary care use. They frankly believe it's really unnecessary for primary care use. They think their patients can easily come in for office visits, and we have a lot more to say about that. Lastly, around convenience initiatives like patient portals, self-scheduling apps, things like that, most PCPs are excited to adopt convenience initiatives. They really feel that it's saving staff time and that their patients want it. Now, in terms of consumers, we talk with them about the same kinds of issues. In terms of wearables and health apps, most consumers are rarely sharing their information with physicians. They're really excited about using wearables, really excited about health apps, but they see their physicians, and particularly older physicians, as tech naive. Um, we think probably the main takeaway from this research, really the overarching finding, is that consumer health tech is disconnected from the healthcare system. And by that we mean that consumers are using it, providers are happy they're using wearables and health apps, but consumers are rarely sharing the information with their physicians, and providers are rarely asking about it. The second observation is that consumers really have mixed feelings about looking to health insurers as experts on health apps or wearables. Some are hopeful that their health insurers are knowledgeable. Others, though, are really worried that sharing data with insurers will cost them financially, or that they just don't see insurers as tech experts, so they don't look to them. Third observation is around the consumer perspective on consumer DNA testing. Those who are using consumer DNA tests or really interested in it, they do expect to discuss the results with their PCP. And remember, PCP say they're not ready. Those consumers, they're really just interested in trying to adjust their lifestyle to try to offset risk. They're not necessarily trying to find a cure. Fourth observation around telemedicine from the consumer's perspective. To us, it seemed that consumers are really surprisingly unaware if their health insurer offers telemedicine. Most of them can imagine a convenience benefit from telemedicine, but there's really little excitement. They really need further education about the types of care that may be a good fit for telemedicine. And lastly, around the convenience initiatives like patient portals, um, many consumers are using patient portals. They really value them. And what really stands out to them is any of those consumers who have a self-scheduling app from their doctor's office. They love doctors' self-scheduling app, and doctors themselves love it. So the convenience initiatives seem to be playing out really well. So to dive into some of these results a little bit more, put some more meat on the bone, um, first about the primary care physician finding. We wanted to call out that the PCPs who are really championing wearables and apps, they love it because it demonstrates patient engagement. And by that, they mean that patients feel accountable, patients think about their own healthcare, and physicians tell us that that means it helps them do their job, and it likely leads to better outcomes. So that's really what's grabbing PCPs in this area. To my personal surprise, PCPs said very clearly and demonstrably that those in-office discussions around health apps or wearables, that it does fit the flow of an office visit. It's not disruptive like you hear some complaints about EHR or EMR systems taking them away from their patients. That's not the case for discussions about health apps. It's part of history taking. They feel that they're more efficient to read than patients' handwritten notes. They're more objective. Patients do not forget to bring them. So in the verbatims you can see there at the bottom, one Gen X OBGYN physician said, rather than trying to sort through their hieroglyphics, their shorthand, and all the notes they stashed in their purse, I can just look at the app data very quickly. So it actually seems to benefit some PCPs. In contrast, some boomers and solo practitioners have little experience with those kinds of discussions. The PCPs who are more ready to use patient wearables and health apps, they tend to be the millennial PCPs and Gen Xers. They tend to be in a group practice versus a solo practice. They tended to be GPFPs, IMs, or OBGYNs. Less ready were pediatricians. And also physicians seeing fewer patients with Medicaid were more ready to be using the wearables and health apps in their discussion. PCPs were telling us that they're really rarely initiating discussions about wearables or health apps, but when they do, it's to try to get some context or objective data. And we wanted to call out some of those exceptions where PCPs are initiating discussions. There are really two kinds of situations. One was where they just happen to notice that a patient is wearing an Apple Watch or a Fitbit. So for example, one GPFB said he was talking about weight loss and activity with a patient, noticed that she had a Fitbit, and they started talking about the Fitbit. He mentioned the app MyFitnessPal, and that brought them into that conversation. It brought the Fitbit into the conversation. The second PCP, an internal medicine physician, said he was talking with his patient about her fainting symptoms. She had reported some lightheadedness, and he said that he noticed that she had an Apple Watch. He asked her if she could share her Apple Watch, and they looked back at her heart rate data at the times that she was reporting lightheadedness to try to better understand what she was feeling, what her symptoms were. So those are cases where a physician is observant and is comfortable talking about health apps or wearables and notices it, and that brings it into the conversation. The second kind of situation we heard about where physicians have learned from their patients that patients are using health apps. So in this case, an OBGYN pointed out that he's really learned from his teen patients that many of them are tracking their menstrual cycle on an app, not on a written calendar. So now he's asking them to report their app data instead of recalling it from memory or a written calendar. So one verbatim from him is down at the bottom. He says he loves having the app because then that way these patients can tell him when their period was. If any patient discusses they're having irregularities, he can have better documentation than someone just thinking maybe they had a period 2 months ago. So it's been really valuable for those few physicians who are noticing things or feeling like they're learning from their patients. Most of the time that wearables and health apps are coming up in primary care discussions, they're about weight loss and fitness. And maybe that's not surprising that in a primary care setting that's the subject of those conversations. Less common examples that we heard about were about fertility, pregnancy, menstruation, heart rate, sleep, and food allergies, those kinds of things. I think to our surprise is that primary care physicians were not having conversations involving health apps or wearables where it touched on diabetes, asthma, arthritis, hypertension, any of these common chronic conditions. If diabetes came up at all, it was mentioned with respect to blood glucose meters rather than apps or wearables. Um, there was, one exception was one physician said he wished he knew of a good COPD app. He's an internal medicine physician and has patients who are older, and he wishes that he had an app for those patients and that some of those older patients might use it. But by and large, physicians are telling us about wellness and fitness apps rather than disease management apps. It really seems like a lost opportunity for PCPs who could be more involved with disease management apps. As I mentioned, the readiness for patient data sharing outside of the office visit, that's really divisive among physicians. Um, for some physicians who are typically older or in a solo or independent practice, the first thing that comes to their mind when you talk about patients sending them data from a health app or a wearable is a concern about liability, that they just can't respond in real time and they'll get in some kind of legal trouble, or it's a concern about workflow, about how can they possibly handle the avalanche of data that would come through. And those kinds of physicians also had the same kinds of concerns with patients communicating with them through patient portals. Diametrically opposed to this were other physicians, typically younger, typically affiliated with the health system, who actually said they'd prefer that patients send data prior to the office visit. They want to be ready to discuss that information. And some of those physicians have their patients sending them data now through a patient portal. It's interesting that some of the physicians who are using patient portals to communicate by email, they wave away some of those legal concerns. They say that those kinds of problems or issues or concerns can just be addressed with a disclaimer, the same way they have in their patient voicemail system. The voicemail says, this is not to be used for an emergency. If it's an emergency, please call this other number or call 911. They say they have the same thing with their patient portal, and it seems like a fig leaf to these physicians, some of the concerns that other physicians bring up. But it's certainly an objection that needs to be addressed. Around DNA testing, as we mentioned, most PCPs are not ready to have those kinds of discussions. PCPs said few patients are asking about it now, but they really expect those inquiries to grow given the popularity of consumer DNA testing. They're actually anxious about how to respond. They feel like they didn't order the test, but they're expected to have answers. They make it clear that genetic counseling is outside their expertise, and some even question how actionable the consumer DNA testing actually is, given how broad the screen is. They make a clear point that it's difficult to find genetic counselors. So if their first thought is to refer, they just don't know who to refer to, and they just don't have much guidance, even from their own health system or professional associations. That's clearly an unmet need. We found the same thing among millennial physicians as among Gen Xers and boomers. They're just not ready to have consumer DNA test kinds of discussions. Some PCPs even pointed out a bit more of a burden. They said, like some consumers did, that some consumers will take their 23andMe data and share it with a third-party vendor called Promethease that does even a deeper dive analysis of common consumer data, and it's just a bigger burden on physicians to try to dissect that and decide what to do with it. I think it's worth sharing some of the verbatims from physicians here just to give you a sense of their own words. Here's one Gen X pediatrician said, what if something comes back abnormal? What am I supposed to do with it? Another millennial pediatrician said, primary care physicians really don't know how to interpret the data. It's really causing fear in the consumer, but she acknowledges half of her family has done 23andMe. Another millennial OBGYN says, we're not getting a lot of guidance here from professional societies. Another millennial OBGYN says, that there are counseling sessions available, but they have some cost associated with them, and they're actually more expensive than the DNA test. And patients, to his perspective, just really aren't interested in paying for the counseling session. Interestingly, a boomer physician, an internal medicine physician, really doesn't think that the consumer DNA tests add anything to the practice of medicine. He felt like if patients will get their physicals and if they go along with traditional laboratory testing, there's really nothing that patients can gain from the DNA testing. We also talked with PCPs about remote monitoring, um, and most PCPs have little direct experience. Some see a benefit for primary care in the future, but others have reservations. Most PCPs are familiar with remote monitoring through specialists, so they hear about it indirectly. So several of the GPFPs and internal medicine physicians that we talk to cite a few patients who are being managed by a specialist and have a remote monitoring device. Um, just as examples, one of the PCPs has a patient who's being managed by a cardiologist, and that patient has an embedded event monitor for AFib. Um, and the PCP just hears about it indirectly. A second PCP also has a patient managed by a cardiologist, and that patient has heart failure. And the PCP knows that the patient has a wireless scale. Again, this physician just hears about it indirectly. And similarly, there's another PCP told us about one of his patients with diabetes who's managed by an endocrinologist, and he knows that that patient's on a Medtronic continuous glucose monitoring device, but again, it's just indirect information. It's interesting around diabetes, most of the PCPs we talk to, they see blood glucose meters as the type of remote monitoring that they have the most experience with, but all of them that we talked to meant self-monitoring during mealtime. None of them meant continuous glucose monitoring devices. Um, most of them said that the patients still bring in logbooks. Some said patients are printing data and they bring it in for the office visit. In a few cases, they said patients were manually emailing uh, blood glucose data through the patient portal. None of them reported any data being uploaded directly or pushed automatically. Some of the PCPs, typically younger ones or those in the health system, they were excited about the prospect of remote monitoring in primary care. They could see a benefit in primary care for keeping patients out of the hospital if they have diabetes or hypertension. Others, typically older PCPs or in a solo or independent practice, first thing that came to their mind was again about liability and workflow concerns. That they wouldn't be able to respond in real time to real-time data, how to get the data into their EMR. They're concerned about unreimbursed time, particularly if they're not in a patient-centered medical home. So these physicians, at the very least, need more education about how that gets managed. And some other physicians who share data have found some workarounds and know about how to deal with those issues. So there's really a split in the views about remote monitoring in the future for PCP. Around the convenience tools like patient portals, most PCPs we talk to already have them or they're adopting them. Most PCPs that we talk to actually have the patient portals and they really value their patients can use it. Practices are split on whether they permit patients to use email through the portal. Um, some are just limiting it just to lookups of information. Many of the PCPs we talk to have a self-scheduling app. Um, my physician doesn't have one of these, so I was excited to hear about it. But we talked with PCPs who just love it themselves for their office staff, and that they actually use it themselves in their own health system, and patients just love it. Others, diametrically opposed. They're opposed to the self-scheduling app. They say that patients make mistakes, that they schedule an appointment and they indicate that they're an established patient, but they're actually not. They're a new patient. They actually need a different provider, or they think their insurance is accepted, but it isn't. And for those reasons, those physicians feel that you need to have staff who talk with the patient and triage those kinds of calls. In contrast, the physicians who do have the self-scheduling apps say that those kinds of cases are really rare and that they're easily managed. Lastly, we talked to a few PCPs who have kiosks or tablets for patients. And those who have them, they're really happy with them. They claim that it saves staff time. One pointed out that they were able to reduce from 2 patient windows to 1 patient window. They feel like it's more efficient for patients to enter or update their data. And a few PCPs note that some older patients may need help, but that they've been able to manage that. When we talked with PCPs about telemedicine and the opportunity for primary care, they were definitely excited about telemedicine for specialist care, but really less enthusiastic about it for primary care use. PCPs see great opportunity to refer patients through telemedicine to find hard to find specialists. And typically they call out psychiatry, child psychiatry, rare disease specialists, genetic counseling. Um, they actually say their health systems are pushing it for specialty care, but they think of it less for primary care, frankly, because they think that patients can easily get in for office visits. They don't seem to fully appreciate the potential convenience factor for certain conditions. They don't think about telemedicine for flu or sinusitis or UTI or rash or medication management and, endless other opportunities that may be there, at least not now. It was interesting to hear PCPs, particularly in rural practices, point out how important telemedicine is to reach distant specialists. In these cases, the PCPs pointed out that for rural patients, sometimes income and technology limitations means that the telemedicine is not happening in the patient's home. It's happening at the local hospital, and there's a room set up in the local hospital for high-speed internet access consult. Um, some PCPs have reservations about telemedicine, and some really need further education. One, a baby boomer, really questions the quality of care that you can have through telemedicine and really sees it as the last resort. In contrast, a millennial, he wanted more information. He's really interested in how physician reimbursement works. And that kind of sparked a question for us. You know, um, the conventional wisdom is that millennial physicians may be more open to non-traditional sites of care, work arrangements like urgent care or telemedicine. They just weren't knowledgeable about it in our small sample. The conventional wisdom is that millennials really care about work-life balance, and arrangements with more flexibility may be more appealing to them. So there may be more interest in telemedicine and urgent care among these younger physicians. We have the same kinds of discussions with consumers. So to highlight some more of the detail here, um, in talking with consumers, they are definitely excited about using wearables and apps for their health, but they told us very clearly that they're rarely sharing that information with their physicians. And one of the biggest barriers is they just see their physicians as tech naive, particularly the older physicians. Most of them believe that their PCPs would listen, that they wouldn't be opposed to listening. Um, they just weren't confident that their physicians wanted to hear it, but that they'd actually act on it. Consumers told us the same thing PCPs told us, that the most common time health apps or wearable information comes up is around weight loss or fitness. Um, they're really not using it, from what we heard, around disease management. We had 5 consumers with a chronic condition, and they just weren't using it to talk about the conditions that they told us they have. They weren't using health apps or wearables to talk with physicians about diabetes, rheumatoid arthritis, allergies, or sleep apnea, the conditions that we had in this small qualitative sample. And consumers told us what PCPs are telling us, that when they're having discussions about app or wearable data, they're rarely sending it to their PCPs. The consumers who are more ready to use wearables and apps for their health tend to be fitness and weight loss motivated, and that's what's driving the content of those kinds of discussions. They tend to be more educated, and they tend to be millennials and Gen Xers. That said, the generational differences, aren't certainly uniform. Not all millennials are the same. Not all baby boomers are the same. For example, among the millennials, we had one who indicated he had absolutely no interest in health apps or wearables because he's young and healthy now, and that kind of fits in line with the stereotype of young people feeling invincible. And I should just mention that we asked consumers and physicians about Alexa and other voice-activated devices, and both consumers and physicians said they don't have any experience with any medical use with Alexa or Google Home or things like that. The most they can imagine is using them for appointment reminders or maybe medication reminders. But if there are other more innovative applications out there, they're not top of mind for either PCPs or consumers. I want to give you a sense from the consumer verbatims about what some of the patients were saying about their physicians and their tech expertise. One Gen X consumer said, I don't think most of these physicians are that tech savvy. They tend to be older than me, and he's 46. Nobody's bringing up apps or anything like that in his physician visits. Another consumer, a millennial, talking about his physician, said his physician's a bit of an older gentleman. I think he had less personal experience integrating technology into what he was recommending. But we thought this was interesting. This millennial assumes that someone who's younger in the profession and uses the technology themselves would probably have more ability to speak to the benefits. So their perception is that younger physicians probably will be able to engage, and maybe there's less of a barrier to have that discussion. A baby boomer we talked with said he's using a Fitbit, but no doctors have ever asked him about it. The only instance where it came up was with a dietitian. And lastly, a Gen X woman said her primary care physicians haven't asked about seeing her Fitbit. She does have breast cancer, and she noted that her medical oncologist does put in her chart that she does try to reach her 10,000 steps. So that's a measure of just activity during her chemotherapy to show that she's staying active and what her sort of performance status is. But otherwise, primary care physicians are not trying to leverage that information. When we're talking with consumers about DNA tests, those who are using consumer DNA tests, and those who want to, they're using it because they want to know about their health risks beyond traditional care. And those who are not using it and not interested, they see the barriers are cost, privacy, or that the potential risk is just years away. It's interesting that the test users and those who want to use it, they do expect to have those kinds of discussions with their PCPs. And that seems like a really a growing disconnect with PCPs saying they really are not prepared to have that conversation. It just seems like there's going to be a clash there or some friction coming down the road. Consumers who are using the consumer DNA tests or expect to, they're telling us clearly that they're not looking for a silver bullet. They're not looking for a cure. They're just hoping to be able to adjust their lifestyle to offset risks. They're hoping they can have that kind of conversation with their primary care physician. You know, some consumers are just not interested, and they're not interested because they're worried that the data will be used against them. I'm sure that's no surprise to folks on the line. Their concern is with health or life insurers denying coverage or raising their rates. And again, another objection, a millennial, just says he's not interested because he's young now. And if there's a risk, it's years and years away. Not surprisingly, without trying to screen for experience, we had little in our study who had current experience with remote monitoring devices. But when we asked them about the prospect, we asked consumers about the prospect of remote monitoring, most were really intrigued by the idea. We had one consumer who has experience now with a remote monitoring device, so we wanted to just call out that example. This fellow is a Gen Xer with sleep apnea, and he was referred by his PCP to a sleep specialist. He's using a CPAP remote monitor, ResMed AirSense 10, and that machine sends data to a sleep specialist via cell line. The patient can view the results online. And really interesting to us was that the sleep specialist can adjust the pressure remotely if needed. So, the patient's sleeping. If the sleep specialist notices something, the sleep specialist can make adjustments to the air and air pressure to the person remotely. The way it worked was that the sleep specialist recommended the machine, helped him navigate insurance to pay for it, referred him to an HME supplier to get the machine, and then the patient thought it was really valuable to go through the HME supplier to get training on how to use the device. So the patient feels it's a success, and he had no privacy concern or reservation. When we pressed about the idea that while you're sleeping, another physician can actually change the device that you're relying on and change how it's working to help you breathe, he had complete trust in that process. So that was an interesting example here. And again, it wasn't through the primary care physician, it was really indirectly to another specialist. But consumers are intrigued about the opportunities in the primary care space. When we talked with consumers about telemedicine, we were struck by how surprisingly unaware they are if they even have it as an option through their health insurer. Most have heard of telemedicine, but they're just not aware if it's available to them. None in our sample had used it or even knew somebody who had. Most can imagine that there's a convenience benefit to it, but there was really little excitement. Most had lukewarm interest. It was interesting. One millennial uh, said, why wouldn't he just use urgent care uh, instead of telemedicine? And another person called out, well, I can use the nurse phone line. So there's some competition for convenience initiatives, and consumers need further education about where telemedicine fits in. They're not hearing about it from their physician in our study, so the opportunities for telemedicine really would go along with some more education, and it's really unclear if it's going to be a more appealing option to younger patients or maybe for older consumers. You could see how you can make the case either way. Consumers, like physicians, told us they're really happy with the convenience initiatives that are coming online. Many consumers really value patient portals. They love having access to be able to look up information, um, looking up labs, test results, upcoming appointments, vitals. Some can even see chart notes, and that's really important to them. One mom, a millennial, told us that she wished her pediatrician had a portal so she could more easily get vaccine records. Where there's a bit of a divide is around, again, interacting through the patient portal. Emailing providers is mixed. Um, some do have access to email and they like it, but they note that emailing can be unreliable through the portal because some physicians check the email through the portal and some just don't. So even physicians in the same group practice or physicians in the same health system, it's hit and miss about whether or not physicians are actually using email through the patient portal. So that seems like a point of frustration, a potential um, ding against the customer experience if health systems are offering interactivity through the patient portal, but physicians are going rogue, going their own way, and whether or not they're using it. Consumers really love the self-scheduling app, but they point out that it really saves wait time. They're not hanging on the phone. They can access it when they're available, oftentimes during lunchtime when a doctor's office is closed. It's just much easier to check work or family schedules to try to coordinate their day. Um, the other kind of administrative app we heard about was one consumer using a Guardian dental insurance app to look up dental providers and monitor claims and carryover balance. So we really think of the apps as being in three buckets. We heard a lot from physicians and consumers about wellness apps, around fitness and weight loss and dieting. A second bucket of apps are disease management apps, say for better managing asthma or COPD or diabetes or arthritis. We heard very little about that. And then a third bucket is administrative apps around claims and provider lookups, and we also heard very little about that. Several of the consumers that we talked to have experience with registration kiosks or tablets. Those who do really like the idea of registering or completing office questionnaire data through those kinds of channels. Some often also say that they can use a patient portal to do that. Um, Several pointed out that they like it for a privacy benefit. They prefer putting in their information on a tablet or a kiosk instead of saying it out loud at a patient window. In terms of who they're looking to for advice, consumers really have mixed feelings about looking to either their doctors, health systems, or health insurers as experts on health apps or wearables. Um, Several consumers expressed interest. These consumers really would like their health insurers to point them towards health apps. They feel that health insurers could be knowledgeable, and it would convey that their health insurer really cares about their health. One consumer was aware about health apps through her insurer, but she had privacy concerns, and those just couldn't be overcome in that instant. So she wouldn't engage with the health insurer in that case. A few just reject the idea of turning to their health insurer. They're just concerned about privacy. They're worried that app data will lead to higher rates, or they just see their health insurer as a claims processing expert and don't know why they would have any particular expertise around health tech. And then lastly, they're not particularly looking to physicians as being tech savvy. Some expect that younger providers might be, but in general, they just don't think of physicians as having a particular expertise in this area. So that summarizes the key findings from the qualitative that we did, and just to point out the phase 2 quant that we'll be doing. This will be fielding over these next couple of months. We should have data by the end of December. Please reach out to us with any burning issues you want us to consider for the phase 2 quant. I'll give you a highlight of what we're planning. We're going to have, again, a primary care physician arm to this, and we plan 100 interviews, 10-minute online survey with a mix of PCPs on the metric that you see on the left. So a mix by subspecialty, by whether or not they're part of the health system or independent, generational differences, geography, and gender. And we plan to do a similar 10-minute online survey with consumers, with 300 consumers. Again, with a mix by type of insurance, generation, geography, gender, and race and ethnicity. Again, let us know any burning issues you might want us to consider for that 10-minute online survey with physicians, separately with consumers. Thank you. On behalf of both Zeldis Research and Schlesinger Group, my contact information is up on the screen, as well as my email. If you have any questions or suggestions you want to send to me directly. Again, we have more information on some topics that we didn't get to in this webinar, so if you're interested in some information from our study about ride sharing, price transparency, or new sites of care like urgent care, we'd be happy to have a separate discussion or send you the deck.